Seven Dragon Radio. I'm your host, M.L.Ruscsak. I'm here with special guest, Dr. Bao Thai. Welcome.
Thanks for having me. I'm excited to be with you.
Now, you are actually a doctor.
I am. My path has been has turned a lot of turns, but growing up as an Asian child, the only thing I ever could be in life was a doctor. I really had no choice by my parents. So this was what I was destined to do, and what I've found myself doing is really helping patients in a way that I never imagined that I could. I started off treating patients with just back and neck injuries, being a chiropractor, and then as time went by, I opened my second practice, and I started seeing these patients with this condition called neuropathy. And for many that don't know, it's a condition that causes numbness, tingling, burning in the feet and the hands. It can be caused from diabetes, from chemotherapy, from spinal surgery, from taking too much blood pressure or cholesterol medications. I mean, you name it. At this point, it's very rampant. That I found myself treating a lot of these patients and figuring better ways to treat them, and that has led me to where I'm at now. And we recently created a new CBD topical cream that naturally helps with nerves, that gives them instant relief with no side effects. And we went through 3 years of clinical testing and clinical reformulations that now has worked better than a lot of patients' medications that they're taking. And so my career has been all over the place, Emil.
Well, it's a wonderful, wonderful journey. But at the same time, I'm hearing so much good things going on with CBD. I try my grandmother with this CBD cream or oil or gummies or whatever I can try with her to see what works with her.
Yeah, CBD, and I'm telling you, I think, so we're actually participating in a clinical trial too with a drug company that actually came out with a CBD pill for diabetic nerve pain. Now, that's just one of the few things we're doing, but just as a whole, CBD is going to change the entire scope of healthcare and medicine for that matter. What people don't realize is in your body, you have receptors for cannabis, that there are actually receptors in our body, and our body actually produces what we call endocannabinoids, and these are chemicals or proteins that mimic the cannabis receptor. So think about it. If you have receptors in your body that accept the cannabis plant, what does that tell you? It tells us that now it can unlock so many different things. So in our body, we have the system called the endocannabinoid system. And what it does is it regulates function. It creates balance with our body. Anytime you're sick, let's say you're stressed out and you catch a cold, it's because your immune system was out of whack or unbalanced, to where now that virus or bacteria or whatever it was can now make you sick. Well, what we're finding out with research in the cannabis plant, that when you take CBD and there's different cannabinoids like CBG and all these different things, what happens is balance is restored. Inflammation is reduced, that people are getting healthier. People's pain that they're dealing with goes away. I mean, all these amazing properties that are happening, that it is going to literally change the landscape of what we see healthcare and how people deal with pain in the near future here.
I cannot wait to hear what's going on with CBD in the future, because there's so much going on with it that we're learning about, that if we can get people off painkillers and give them something natural,
yes,
that is the key.
100%. I mean, we always hear about that opioid epidemic, right? People are addicted to pain medications. In my space, in dealing with neuropathy, people are on pain medications all the time. And so one of the most common medications people are on, it's gabapentin and Lyrica. And once you get to a certain dosage, and typically it's between 3,200 milligrams and 3,800 milligrams a day, that once you're on that kind of dosage, you turn into a zombie, meaning you can't think anymore. All you're doing is sleeping. So if you're someone that suffers from pain, what kind of quality of life is that anymore when all you're doing is sleeping, and you can't think?
Exactly. And the painkillers affect every individual differently. So even a low dose, like I was on, made me a walking zombie, where that low dose for someone else, they're perfectly fine and functioning. But at the same time, what is the gabapentin, the Lyrica, what are those pills doing to us internally.
Yeah. Well, there's the way you have to the best way I explain to the patients is, in between each nerve there's a gap. And think of the nerve right before you get to the brain, there's a gap. And for that information to cross into the brain and for the brain to interpret it, there has to be a fluid that's filled into that area. And that's what we call a neurotransmitter. Well, what a lot of these medications do is they stop that fluid from being produced. And so what happens is, let's say you got pain in your foot, ML, and then that information is traveling up the leg. And then right before it gets to the brain, that fluid that normally would help transmit that information and goes across doesn't get produced. And so what happens is that pain signal never gets to the brain. The brain doesn't recognize that that pain is there. And so all you're doing is making the brain forget that the problem is there. But the more you do that, the more the problem gets worse. And as time goes by, as the problem gets worse, well, then now your quality of life starts to decrease more and more. And this is the cycle that I just saw a patient earlier. She had surgeries, she had all these different things, tremendous pain after all that, all these problems with her nerves. And all the doctors want to do is give more pain, more pain. But if you had CBD and you had all these other things, I mean, now you could literally give those patients, the CBD or whatever natural treatment options now. Well, it could actually change their life for the better. And I'm super excited about that.
Exactly. We need to get away from the chemical reaction because we get dependent on it. If we go to a natural reaction, now our bodies can actually heal whatever it is that's causing the issue.
Yeah. It's a crazy concept, right? Your body can actually heal.
It is mind-boggling, right?
Yeah. I think we've gotten way too technologically advanced, and especially when you consider healthcare, right? In my opinion, we have too many specialists. And it's like, you got to see a specialist for this and a specialist for this, and then they never talk. And nobody ever recognizes that your body works in harmony with other systems. That if the harmony isn't there, how are you ever going to get well?
Thank you for saying that. Not too many doctors, doesn't matter what medical field you're in, will say that.
Yeah. Well, the thing is, I'll tell you the stories that I hear. I mean, I heard the other day there was a patient, he's telling me about how he missed out on his grandson's graduation. He missed out on him and his wife's 50th anniversary trip. And, you start asking, well, why? It's because the pain was so bad that all these doctors are treating, separate things. And what it led to was him having to take more and more and more medications. And his life was just passing by. And, it's really sad how when you hear somebody say, if I knew my life was going to be like this, ML, just take me now. Just God, take me now, And I've heard this so many times that I have nothing but empathy for all these people and nothing but compassion. And that really is what drives me to continue to push this envelope and figure out better ways to do things, because everyone deserves it.
Exactly. We need to improve our quality of life, no matter what age you are. Because how many people are in there? I seen a 16-year-old today that is in chronic pain from a accident they were in, and they're just on more and more medicine. Well, you're not healing at that point. Or is the pain problem healed and your brain just registers it's not? Yeah.
Well, it's and again, I know this is a touchy subject, but let me preface by saying this. I think there's a time and place for everything. But when you look at big pharma and the way pharmaceutical medications are designed, they want you as the consumer to keep taking the medications. Now, if I had a infection and I took an antibiotic, I know when I'm going to stop taking the antibiotic, when the infection goes away, and typically everything is dosed out properly, right?
Right.
But when you look at pain is a multi-billion-dollar industry because of the methodologies that are used. It is, like you said, to treat the symptoms. It is never to treat the root cause. We're so technologically advanced, but what hinders, in my opinion, for most doctors, is now the inability to say, you know what, I don't want to follow these insurance regulations. I want to go out on my own. But the problem is finances start taking, starts crossing their mind. I mean, all these different things that they have to consider, and it really ties up their ability to really be doctors and to code and really to find out the root causes of the problem and treat them properly.
Exactly. How many doctors are out there that are leaving the medical field
Yeah.
because they can't treat the patient? They can only treat the symptoms, and they have the compassion to treat the patient, but they're not allowed.
Yeah, there's so many, there's a great movement now, and there's a whole new group of doctors called functional medicine doctors. They're kind of that X factor now. So they're the ones that are branching off, that are looking at the body as a whole. They don't just look at your symptom as this. They look at it as, what are all the different causes? How do we look at all the different body systems, and how do they all incorporate into this? It's a really new and exciting, medical field that I see and I hear about more and more and more, that I think there's for this next generation, there's going to be a bright, bright future as far as their healthcare being able to live longer, but not only live longer, but live better. And I think that's going to be a key.
Yeah, when we add in the CBD to our health,
Mm-hmm.
and we actually get our insurance companies to actually pay for the CBD, because
Yeah.
no, the big pharma's not doing the CBD. This is individual.
Yep.
So you have to pay it out of pocket, but at the same time, it's a lot better for you.
Oh, 100%. It was like our rapid nerve rescue cream, right? So I spent 3 years, formulating it and retesting it. And luckily for me, I had the patient base to test it on. I had a plethora of patients dealing with this problem, that I just said, hey, would you mind if we test this on you to see if it works or not? And they're like, go for it. And, as we went through testing, one of the best days was when we tested it against their gabapentin and Lyrica. And I finally heard from them that this works better, that your CBD, CBG cream, this cream that you have gave me more relief than this pill that was prescribed by my doctor. And to me, that was such an epiphany, because it just showed me the power of CBD, how, your body, again, has receptors for it, that if you give your body what it needs, it flourishes. And I think that's, again, I can't get excited enough about it. It's going to change this world.
It will. I mean, if you take a young person, an elderly person, anyone in between, and you give them the CBD, and within 6 to 8 weeks, usually less,
Yes,
you see drastic difference.
I know. I've heard stories. I mean, and I think for the lay person out there, the easiest thing to remember is anything in your body that causes problems is, most of the time, I'd say probably 95% of the time, inflammation based, right? Inflammation is the mother of all evils. Well, simply, CBD is a natural anti-inflammatory. You take a natural anti-inflammatory and you introduce in your body, what's going to happen is now you're going to start improving. And we're seeing it more and more and more and more.
Exactly. You can use it for neuropathy. You can use it for arthritis. You can use it for almost anything.
Yeah. Well, I think that's also the confusing part. Wouldn't you say? It's like, how can something, and again, this is for people who don't understand, but because I used to think this way too, when I started learning about CBD, and I was like, how in the world does CBD, this one thing, help so many different things, And it wasn't until you started getting down to the root causes of the problem, which is inflammation. And as long as you deal with the inflammation properly, you're going to get a result.
That's the whole point of medicine, or should be the point of medicine.
Yeah.
It used to be the point of medicine.
Yes. Yep. How long have you been using CBD for?
Actually, I've been trying different things for about the last 2 years, because I do have neuropathy from strokes.
Oh, got it.
Yes. So I will try anything to get rid of the pain just so I can function. But
Yes.
I can't do the gabapentin. I can't do the Lyrica. I can't do anything stronger than Tylenol.
Yeah. Well, you got to make sure. I'm going to send you some of my cream for you, because I want you to use it.
Oh, that would be so wonderful.
Yes. I'm going to put it on my list right now. Send ML cream. You got it.
Wonderful. I thank you for that. Now, where can our listeners and viewers buy your cream?
Right. So if you go online at www.rapidnerverescue.com, that's rapidnerverescue.com, You can order everything online there. We do have a money back guarantee. Our goal is really to help people when everything else has failed. That's always been my mission in my office. So I have an office in Dallas and Houston, where we treat neuropathy, and I've been doing it for over 10 years now, successfully with different methodologies. So, really, if you search us, look us, we're always there to help you, to do what we can, and to really help impact people's lives for the better.
That is wonderful. And again, if you're in that area, being able to talk to you directly is always a wonderful thing.
Yeah, absolutely. Well, I do a lot of speaking as well. If most of the time we do a lot of CBD shows. I'm a big speaker on the circuit, because again, I want to help educate and opens people's eyes to, like, there are other solutions out there, that you don't have to live this way. You don't deserve to live this way, but it just takes a different thought process and a different way of looking things. And CBD might or might not, but I would probably bet it could probably benefit you in some form or fashion if you use it properly. And it's up to us as doctors to educate people.
I almost had my mom off of cigarettes due to CBD.
Did you really?
Yes.
That's
almost.
amazing.
It was almost worked. And then something came up and she's like, well, I can't take this if I'm having surgery because they won't do the surgery. I'm like,
Right.
Almost.
So close. So close.
Yeah.
Keep trying. Keep trying, ML.
We will keep trying with her, but I thank you so much for your time today.
Got it. Thank you
And
for having me on. It's such a pleasure to be on with you.
This has been a very educational show.
Got it.
And this is one of those shows that everyone needs to hear because CBD can change your life.
Amen to that.
And for our listeners and our viewers, happy healing.